A 5-year-old girl is brought to the pediatrician because of the generalized edema. Laboratory testing revealed proteinuria of 5 grams per day and podocyte food process effacement is seen on electron microscopy of a renal biopsy. Disruption of which of the following component of the filtration barrier is contributing to this patient's proteinuria. So pick up the point that the patient has generalized edema. Patient has proteinuria of 5 grams per day and podocyte food process effacement is seen in electron microscopy of a kidney biopsy. So the sign that is generalized edema and proteinuria more than 5 grams per day is directly presenting the nephrotic syndrome, that the patient is suffering from nephrotic syndrome, some sort of nephrotic syndrome, okay, because it has a heavy and a massive proteinuria. The cause of the nephrotic syndrome is, it may be some sort of autoimmune, it may be some sort of bacterial infection, or it may be some sort of changes in the some cytokines which leads to changes in the charge barrier of the food process of the podocytes, because we know that in kidney there are a membrane barrier and there are also the charge barriers. First of all, the endothelial membrane, then there will be the basement membrane, and then there is the podocyte. There is the specialized cells which is responsible for the filtration and prevention of the charged particles, mostly the albumin, because the albumin is negatively charged and the food processes also having the negatively charged, so they repel the albumin and so albumin are retained into the blood. So these two, they act in these three, okay. Say number first, there is the endothelial, basement membrane and the podocyte. They all act as a barrier for the filtration purpose. So in case of nephrotic syndrome, some causes, some etiology, okay, or other factors, they leads to the disappearance of the uh, charges, disappearance of the charge barrier. So when the charge barrier disappear, of course the charges cannot prevent further the protein, okay. So the protein, that is the plasma protein, more specifically the albumin, they start to leak out into urine. So there will be massive proteinuria and it is a selective proteinuria. So this condition is called as nephrotic syndrome. But they ask that what are the structures and what are the things which is when they disturb, it leads to the nephrotic syndrome. The brush border endothelial cells, heparin sulfate, integrin and type 4 collagens. Our mind will click two answers. Number first, there is the type 4 collagen, and number second, that is the heparin sulfate, because brush border is not related to this one. Endothelial cell, no, because if the endothelial cell damages, then there will be some not non-selective proteinuria, then some inflammatory process start to occur here, which finally leads to nephritic syndrome, okay. So the heparin sulfate, so let's discuss about something about the heparin sulfate. So as I said that the podocyte, their food processes, they have negatively charged particles and these negatively charged particles act as a charge barrier, okay. So the heparin sulfate molecules are present over the food processes, okay, the heparin sulfate molecules, and these heparin sulfate molecules are negatively charged particles. So they are negatively charged particle. So the main substance, main component which acting as a charge barrier is heparin sulfate. So the heparin sulfate is responsible for the charge barrier. Whenever any reason due to any cause, there is a destruction of these, neutralization of these heparin sulfate molecule, then the charge start to disappear. Okay, and it leads to the nephrotic syndrome. So in this condition there is a neutralization, okay, disruption of which of the following component of the filtration barrier is contributing to this patient's proteinuria. So our answer is this. That is the disruption of the heparin sulfate leads to loss of the negatively charge, and it leads to proteinuria and albuminuria, and this condition is called as nephrotic syndrome. So it leads to generalized edema and hyperlipidemia, hypoproteinemia, so all these conditions.